Cameron. Okay, here we go. What is your full name?
Angela Carriega.
And where are you from?
A little bitty town called Woodville. It's here in Texas.
Do you live here in Houston?
I do.
So what is your employment background? What do you do?
I'm a registered nurse at Texas Children's, and I've been there since I graduated from UT School of Nursing here in Houston. It'll be 5 years in May.
Awesome. What is your current title?
I'm a registered nurse. I graduated in '06.
When you started, what were your primary duties and responsibilities?
When I first started, it was just to be a nurse, take care of my patients, and I was on orientation for 5 months because I work in an ICU, so you have a longer orientation, but you do everything from assess your patients, give meds, all your basic nursing duties.
So have your duties and responsibilities changed at all since you began?
They have now. Of course, I have all the basic nursing stuff that I still do, and then I precept new nurses, so I take them through the same orientation that I went through.
Did you know early on in life that you wanted to be a nurse?
I started out wanting to be a baby doctor, as I called it, in like 3rd grade, just because I loved kids. And then I ended up being a nurse after college and organic chemistry and finding out how long I would be in school and in med school. And then volunteering at Texas Children's and seeing how the nurses interact with the patients versus the doctors changed my mind.
Was there anybody who influenced your decision to go into nursing, like a neighbor or a role model?
Well, making me want to be a baby doctor was my pediatrician. I loved him as a kid growing up, and I saw him until I was like 15 years old, from the time I was like a year old. So I really liked him. But then when I volunteered at Texas Children's, there was a nurse named Irene who talked to me a lot and made me, see how cool it would be to be a nurse and how much more patient interaction I would have. So she helped to change my mind.
Cool. Now, briefly describe your formal education. What type of degree did you get or certifications?
I have a Bachelor's of Science in Nursing. It's a 4-year degree. So I did prereqs at the University of Houston, and then I went to school at the University of Texas School of Nursing here in Houston. And then I took my state boards afterwards to get my license.
Did you have to take a communication class?
I did. I took speech as a prerequisite in
college.
Yeah.
Speech is a great class. Do you plan on continuing your formal education?
My plan was to graduate and work 2 years and then go back to get my master's to be a nurse practitioner. But I think now, since I have a baby, I want to wait until maybe she's school age and then go back to school while she's at school.
Oh yeah. So what sort of hours do you work?
I work 36 hours a week, which qualifies as full-time as a nurse. So I work 3 days a week. And we do self-scheduling, so we kind of just do our own schedule. But 3 days a week, I work 7 a.m. to 7 p.m.
That's cool. And so are they willing to work with you since you have a young child?
Yeah, since we do our self-scheduling, we put in what days we want. We get 4 days a month that we can put X's that they can't put us onto those days. And then they only move us to balance the schedule, but it's minimal movement. We just have a weekend requirement, and that's it.
Yeah. So do you have good benefits?
We do. We have really good benefits.
Are they affordable?
They are. They pay. The employer pays most. They give us select dollars, is what they call it, a month to go towards our benefits. And then Texas Children's has a lot of cool things like random benefits, like adoption benefits. For people who want to adopt, they'll give you $5,000 toward adopting a child. All kinds of stuff. So they have a really good benefit package.
So are they affordable now that you have a child and you've added that child on?
Yeah.
That's good.
They've recently gone up, but everybody's has.
Yes, everybody's has. Mine too. What is most stressful about being a nurse?
Just the fact that all the responsibility that's in your hands. It's literally a matter of life and death. In my situation, it's not always like that for every nurse, but I work in ICU, so it's a matter of life and death every day when you go to work, So it's the medications that I give are big medications. They're not just like Tylenol, So that can be stressful, but I like to deal with it.
What do you like most about your job?
I see a lot of cool stuff. Patients, like I had one recently who was a baby, been in the hospital all her life and came from out of state because that hospital told her they couldn't do anything else for her. She came to our hospital, got lungs, and she's now at home, and she had never been home. So it's really cool to see stuff like that. Yeah.
What do you like least about your job?
the other side of that, where somebody doesn't get a transplant that they need and they pass, or kids who come in coding or needing CPR and just super sick. We see a lot of non-accidental trauma kids, which are beatings and shaken babies. So that's my absolute least favorite part of the job.
I can imagine. That's hard to hear.
Yeah.
What types of situations do communication downsides or challenges most often occur?
I think for us on our unit is when a code situation, when a patient either comes in coding, which meaning needing compressions or medicine and all that sort of stuff, whether they've stopped breathing or their heart has stopped, it's a high emotional situation. So sometimes you have your type A high strung people a lot in the medical field. So sometimes people need to remain calm, and sometimes people have a hard time doing that. Or emotion. You get so much emotion involved that it's hard to communicate clearly. So that becomes an issue. But we have meetings and debriefings after codes to help us improve on that all the time.
Well, that's good. Sounds like they're willing to work with you.
Yeah.
So what are some of your communication weaknesses?
I personally, my biggest downfall, I think, is that I don't speak fluent Spanish. I speak some Spanish. I've taken 4 years of Spanish. I took 3 in high school and then Spanish for nurses in college, but I stopped using it, and that's the biggest thing. And I can communicate basic things to them, but when they start asking about pathophysiology or just their child's plan, I don't feel as comfortable. So I think that is our biggest downfall, is that we don't all speak it, and that's the biggest communication problem that I see.
Yeah. Do you have like cultural competency training to assist you in
Texas Children's is big about that. We have required trainings every 3 months, at least once a year that comes up, and they have a website now that they just launched, or a part of the website that we have that's part of our intranet, and you can go to it and go over info, just kind of facts about different cultures that gives you an idea, how to interact with them. Like some cultures, like Hispanic people, some of them believe if you look at a child and don't touch them, that's something bad. They call it the ojo, and something bad will happen to them. So if you look at a baby and you say, oh, they're so cute, but you don't touch them, some of them find it offensive. So there's little just tips and stuff like that on the website.
That's awesome.
Yeah.
They have all that training. What challenges of effectively communicating with patients or other healthcare professionals from different cultural backgrounds?
It goes to the whole thing like that. There's some cultures, direct eye contact is insulting, and for me, I'm a big person if someone's talking to me to stare at their eyes, it makes me feel like someone's paying attention to me, or that I'm paying attention to them, and for some people it's offensive. And sometimes male and female interactions, even some of the other doctors who are quote-unquote Americanized and have been here, they still don't look at you when they're talking to you. And at first I found that really offensive if somebody's looking beside me. I think it could kind of interrupt your rapport building with other doctors. So just learning and having all those resources that Texas Children's offers helps you understand where they're coming from, so you realize it's not anything personal.
Oh, yeah.
And I think that helps.
Really helpful. So how do you handle the language barriers? Do you guys have an interpreter?
Yeah, we have a language services staff we have them on call. We have them in-house all the time. There's at least 2, but then there's a full staff during regular business hours. And then we also just got a machine called Marty that literally rolls into the room, and you can type into it. It has a camera, and it will talk back in the language that the person needs to hear. And then when they talk back, it gives it back to you in English. And then we have phone interpreters that they can call, and you can, go back and forth.
That's awesome.
There are a lot of resources.
I want to learn Marty.
Yeah.
I want to meet Marty one day. Do you guys have brochures or pamphlets, other materials in different languages?
Yeah, we do. We have Spanish stuff all over the unit because it's the most common language that we, have other than English. But we do have other stuff available through language services, and that we can print off of our internet in other languages.
Do you think gender plays a role in how you communicate or how others communicate to you while you're on the job?
Not necessarily with my coworkers, but then again, like I was saying with other cultures, sometimes fathers won't stay in a room with their children if the nurse is female, because then they're, or vice versa. There are other cultures who the mother is not allowed to be alone in the room with another male. So if there's a male nurse, it's an issue. So talking and communicating that way, the male nurse with the mother, is sometimes hard. You have to have someone else with you at all times. And for me as a female